Oh, I guess I'll go. The first question I see is, what's a good dose of LDN to take if you get COVID and want to decrease the likelihood of long COVID? Um, I don't know that there's actually, because they haven't studied that specific question, but it looks like you could probably start the 1.5 and then titrate up traditionally. You could even start lower. Nobody really knows for sure, but I think they're recommending, the FLCCC is recommending the 1.5, titrating up every 1 to 2 weeks, then to 3, then you can go every 1 to 2 weeks up to 4.5. And that's, I think, what I would try if you get COVID. Anybody else have an answer to it?
A couple of questions here came out about pets and the dosing for pets. As I said earlier, there's not really a big study, but what we've seen in practice, and most of the time you use about 0.3 milligram per kilogram, but you kind of max it as like human dose. But the only thing is with pets, they are higher metabolizer of LDN, so they use LDN and metabolize it quicker. Sometimes you need to do it twice a day dosing, and sometimes, but maximum about like right around the same dose. Sometimes we've had with bigger dogs and probably a little bit higher than human dose because they're just faster metabolizer and it works really good for them. And then also, I think maybe Dr. Sato-Re already answered this on the autism. Other medication or just by itself? I know I've seen it by itself or both, but I don't know what your thoughts are, Dr. Sato-Re. Or I mean, I've seen really good result by LDN by itself for autistic kids, and they were on other drugs, but then such a different when as soon as they get in, and parents usually say, oh, I see the difference when I don't give it to them in the morning. So, and it's easy, the cream works really well. So I don't know what.
Yeah, I agree. I mean, why not? It's really easy to try. It's pretty harmless. I mean, it is harmless, I think. Yeah. And yeah, it's another, there was a brother and a sister that I also used it on. And they became, the parents, like one of them was an escape artist. The parents were like, he stopped doing that. He would actually come into the classroom and actually participate and like carry the chair to the, story time and be more interactive. And yeah, they thought it was great, but they live in Stockton, and somehow with COVID and the kids stopped going to school, and, so they stopped using it. So yeah, but sometimes you get lost to follow up things, but yeah, there are some amazing changes that happen.
A patient saying, I've had severe psoriasis for over 16 years. I started LDN in September of 2021. The current dose I'm using is 4.5 mg at night and topical LDN cream in the morning that Dr. Rashidi made for me. I've not seen any improvement yet. Any help or anything you could add for psoriasis would be a great help. And so my thoughts on this were, I've seen really significant improvement to psoriasis with the removal of things. So the removal of food sensitivities, I think, could potentially really go a long way. And I would say that individual patient might want to consider whether they're in an environment that they're being exposed to things like molds or mycotoxins, something that's kind of keeping their immune system ramped up. Also, being on LDN since September of 2021, that's not a super long time. I guess it should be long enough to kind of see the benefit by now. But yeah, I think about staying on the LDN, including the cream, and then maybe doing a little more testing and seeing if there are other things that we can remove that would improve our benefit.
Yeah. And then with the skin and pain, I know I always say it takes the longest and sometimes higher. And I know Dr. Sato-Re talked about, like, with the skin, you even want to go maybe higher. And one of the reasons we haven't gone higher because we're doing both topical and or also, I don't know what your thoughts are, either of you, if you go higher maybe works just because maybe oral higher.
I would certainly consider it, yeah, with them for sure.
Another question was for the breastfeeding. We have done a lot of research on this. This is fine even for pregnant women. Sometimes actually doctors start with that. We haven't seen any issues with the breastfeeding, although there's not a big, again, study, but what we've found in the literature, it is okay with the breastfeeding moms. I don't know if anybody else has seen anything.
There are several presentations by Dr. Phil Boyle, who has a fertility clinic, and he uses it to help the women get pregnant. A lot of these women have had multiple miscarriages in the past, and he's found that the mums do really well throughout pregnancy. If they're likely to have a cesarean, he'll stop the LDN, prior to that. They take it during breastfeeding, and the feedback he's had from the babies that have come back when he's done follow-up checks, that the babies seem a really good weight. They have less chance of having antibiotics, and they're more contented. So the mums are really, really happy that they have a contented baby. I was born 5 weeks early, and apparently for that 5 weeks, I did nothing but cry. And my mum used to put me down the bottom of the garden and shut the door because she couldn't stand the crying. But as I say, he does use it, to help women get pregnant right the way through. And those videos of his presentations are on the website. If you put in the search Dr. Phil Boyle, they will come up.
And any contraindication with ivermectin? Obviously, I mean, I'll do it as a pharmacist. There's no contraindication with any drugs that we found, except when you are on opiates, and we all talked about it. You want to either separate them, don't take them at the same time, or that's the only contraindication we've actually seen. Nothing else really that contraindicate. Even people drink alcohol or whatever, there's no issues with that as well either. So no problem with ivermectin or any other drug.
As it tells the immune system to calm down, is the immune system able to fully respond to any new virus or illness, or do you need to cease LDN until over the acute illness? Thank you. Yeah, I would say no, you don't need to stop it. It actually, your body can actually still completely respond to the virus or illness. It actually, like we were saying, it may even prevent some viruses or illnesses, but it also will enhance your inflammation. It won't cause you to over-inflame, like have a cytokine storm. So, no, you don't have to do anything, and you'll respond appropriately and be good. So it only calms down like over-inflammation, not regular inflammation. So.
Maybe I'll do. Yeah, I'll try to catch up a couple of the ones that I already answered. So this one was a quick question about sleep issues. What would be the dose? And my response was, it's really hard to say. A lot of people initially experience sleep disruption. So we might see the first week or so after initiating LDN or dose escalating, a little bit of restlessness at night. And then after that, it'll kind of settle down and we might see those deeper states of sleep, but it's hard to say. I would say that's probably the dose for that individual is where they're going to see the best benefit for sleep in general. I don't think there is just specifically a sleep dose. And then I'll answer another one real quick. There was a question about what's the cutoff in liver enzymes to not use LDN. I don't think there's a definitive cutoff. A lot of folks have mildly transient elevated liver enzymes from non-alcoholic fatty liver disease. I would totally use low-dose naltrexone with them. If their AST, ALT are in the 30s, 40s. If those liver enzymes jump up dramatically, we're going to want to figure out what's going on before we initiate any new medication. So yeah, really, like all things, depends on the patient. And then one other one real fast was, do we need to be dairy free? Because this individual's heard that dairy can have an opiate effect, which is true. There's casomorphine in dairy. It has a very mild opiate receptor activity. No need to be dairy free when using low-dose naltrexone.
One thing I want to add, like always, for any of this to really work, and I know Dr. Mathewson talked about it a little bit with the patient with also the psoriasis, gotta have a good gut. So we always recommend people taking a good probiotic with LDN, just because if I mean, the gut health is the most important. I'm sure we all agree here, but it's just really important to get a good probiotic and just make sure you're clean eating. And a lot of time gluten does contribute to a lot of these overall autoimmune issues. So if you haven't tested for gluten sensitivity, it's great. I mean, sometimes people, they never thought they're gluten sensitive, but they do testing. And I know both doctors here, they do a lot of testing on that. And I'm sure I've talked to them a lot of times and they all see it all the time, which is not surprising sometimes.
I'm just going to add that for food sensitivities, gluten and dairy are 1 and 2. Pretty much 1 and 2. That's what I found.
Mhm.
Then best dose of LDN for Hashimoto's, what I have seen is like a little bit less than 3 or around 3 milligram. I don't know, but usually when you go to higher doses, you lose that loss of like reduction of the antibodies, and that's mostly, I think, for the prescriber. They can, I'm sure they do test all the time and see it better.
Usually I start at 0.5 and move up by 0.5. So
okay, very
and
slow.
yeah, and then to wherever it is, it gets to be.
LDN 0.3.
I'll answer one real quick. This one is from Miss Carol, and the question is, why is LDN suggested for nighttime? How is taking it during the day? And she says it takes her a little while to get going in the morning. Generally, we recommend taking LDN in the evening because that's when our natural endorphin production is going to be most active, and that's what the system we're trying to target. The other thing is when we take LDN and it gets on the opiate receptor, it can cause a little bit of a flattening feel for that individual, right? So just because all your natural opiate receptors are kind of bound up. So we think if we can, it's nice to get folks to sleep through that in the evening as opposed to being awake for it during the day. But I totally have folks that feel better taking their LDN first thing in the morning. So I think it's very individual. And I think it's something that's very safe and easy to kind of tinker with. Just try it and see how you do with it.
Very true. Yeah, that's why a lot of times now we have twice a day dosing and also morning. I have seen a lot of people change to morning dosing, and just because they couldn't get rid of that insomnia, which is like only maybe 1 or 2% of people. Is not really high, because most, I mean, for myself, when I take it, I actually now sleep better after that insomnia and vivid dreams are gone. But the vivid dreams are always fun too. Sometimes, you know, if you kind of remember what you've seen in, and it's very clear dream. So
yeah.
God, there's a lot of questions. Let's see. It's hard to, there's one in here that says a son on 12 milligrams of LDN and got COVID 3 times pretty badly. Sadly, he was forced vax and all boosters. It's hard to answer specific questions. I don't know the history, you know, like we don't know the history on that. But I would suspect that that's not the right dose for him. Somehow, that's just what I would say. I'm not sure, and could try starting over. I don't know what the right dose would be, but I would just question that. I don't know. Anybody else feel the same?
Yeah, that seems like a really reasonable spot to start. Yeah.
And about dogs, like we don't treat dogs, so I don't know. This one says regarding dogs,
the 0.03 milligram per kilogram is the right. I mean, it's per kilogram, not pounds. I think that's what we have done, but that's about the right dosing. And somebody asked if it's okay to. I mean, it's as Dr. Sato-Re at the beginning said, she thinks it should be in the water. I think we all need a little bit of anti-inflammatory in our body. So, I mean, because there's no long-term effect that we've seen or any like liver issues or anything with such a low dose, most people benefit. I mean, worst case scenario for a lot of these diseases, I always tell people, it just, worst come to worst, you've tried 40 different drugs for your disease, one more. If it doesn't work, it doesn't work. But if it works, we hear all the time, that was life-changing. So I mean, I hear it every day. That changed my life, and that's why we do all this, to make sure maybe we change one other person's life.
Yeah.
Yeah, for sure. For sure. Okay, this one says LDN caused like a paradoxical effect on my son with ASD, caused him to scream like someone cut off his foot when he stubbed his toe. Again, hard to comment on it because we don't know the whole situation. But again, I would wonder if the dose was incorrect. And I wouldn't necessarily give up on it. It's just that you have to figure out what the right dose is. So, yeah.
Dr. Mathewson, would you like to go next?
Yeah, I'm going to circle back to that, the psoriasis question, because it looks like a follow-up popped up in the chat about that. And the question was, if it can take up to a year for the LDN to work, how do we know what dosing will work if it takes a year to show results? Which is a great question. With something like psoriasis, I would expect to see some benefit along the way before we get to a year. I'd expect to see that benefit starting within the first kind of handful of months, hopefully. So it's hard to say. Yeah, but we should be seeing benefit along the way, whether it's not a full resolution of the plaques. We should see them getting a little bit smaller. I definitely don't want to see psoriasis getting worse. If we see psoriasis progressing while we're on LDN, that's a stop, dig back in. We need to look at a lot of different things in that case, because it should not be progressing at that point in time. So yeah, dosing is same thing. We're kind of looking for that sweet spot where you personally feel the best. And that'll be different for different folks, but you know, it should kind of be in that range that we've been talking about.
Any specific probiotic any of you recommend? We usually do a lot of Metagenics just because they have such a wide variety of different probiotics for different conditions, and I know Molecular has really good ones as well. But for, like, you know, as a just a daily ultraflora balance, like from Metagenics, is really good, because that's like kind of covers everything if you're not taking it for a GI issue or UTI or any kind of that. So that's something we go a lot about, just to give yourself, as we age, we're not going to produce as good bacteria anymore. We need to replace them somehow. And a lot of people come to us, say, I eat a lot of yogurt. Yeah, good. But how much yogurt you eat? Because you need a lot of bacteria. Unless you eat a whole bucket of them every day, you're not going to get enough. So getting some probiotic is not bad for everybody.
I would say just make sure it's a good quality probiotic. Yeah. You know, and usually one that's a pharmaceutical grade, Metagenics, I don't know, like orthomolecular, you know, there's tons of different ones.
Yeah, there are a lot of them.
Just as long as it's a good quality probiotic.
Good point, yeah.
Well, someone asked if they needed to taper off low-dose naltrexone. I have not seen that. You can just stop use. Yeah. There's no need to taper. And I would say it is safe for all ages. I don't treat pediatric patients, but I've seen, you know, I would be comfortable going down to preteens and starting LDN with them. My comfort is only because I don't treat those younger cases, but there's no reason that I wouldn't treat someone kind of less than 12 if it was appropriate and seemed indicated. There's no upper age limit either. And I do love Megaspore probiotics. I think those are great ones. That just popped up in the chart. Those are great probiotics. Start slow and low with those. You can give yourself some real tummy rumbles if you're going too fast.
A really strong dose. And then as far as the fatigue, I think a lot of times been used for that as well too, because of that endorphin increase, and it helps you for a lot of chronic fatigue patient. Actually, we have seen really good results with LDN, and sometimes actually we do it like I've had one patient that we talked to the doctor and we ended up at like 3 times a day, just because she would just get up and not be functional, and then a few hours later we would get tired. So we do like morning dose, very small doses, but then throughout the day, and maybe the last one around, like I tell them, like around 4, she couldn't even go to school. This girl was really sick and fatigued, and she had fibromyalgia. And after a couple months, she, the first time they came pick up the medication, she didn't even talk to me. The mom was talking to me, but the second time she was like so excited about LDN that she was talking and telling us how she's going back to school. And it's amazing how for some people it works so good. Just like it's amazing.
Dr. Sato-Re, would you like to go next?
Okay, so I don't know. I think we already talked about this. I'm not sure. If you combine oral and topical, should we consider not going over 6 milligrams in total to not get over the low dose range? I would say, yeah, because once you get over the 6 milligram dosing, I mean, depending what you're treating, sometimes you can have, it may work fine. You just kind of have to see, but some studies have shown that there's lower anti-inflammatory effect and lower pain effect. It just depends on the person, I would say. So.
Thank you. Dr. Mathewson?
Yes, ma'am. Let's see. Is sheep dairy okay in terms of food sensitivity? It really depends on that individual patient. I see less reactivity to the non-cow dairies, but certainly some folks who have a really significant cow dairy sensitivity will react to the proteins that are showing up in sheep dairy as well. So things like casein is going to be in all dairies, whey is going to be in all dairies. It just kind of depends on what in the dairy is reactive for that person. Yeah, and then there was another question about needing to take low-dose naltrexone on an empty stomach. Dr. Masoud, I think
Go
you're
ahead.
going to answer that.
Go ahead. No, you're good. No,
I
you're
have
good.
not had any reason to tell people that they needed to avoid taking low-dose naltrexone when they were eating. Generally, I have folks taking it before bed, so they've not had a big meal in the hour or two right before then. So I don't think there's anything. Masoud, would you agree?
Oh yeah, no, I've not heard anything. It shouldn't be such a low dose. You shouldn't have any issues.
Okay.
I don't know. Unless you have GI issues, then we usually recommend just taking the sublingual, something under the tongue, just to avoid anything. But other than that, it's like really not been any issues that I know.
Okay.
I'll just say, does anyone else have any experience with using LDN for, I think it's scleritis. I am not sure, of unknown origin, and eye scleritis. I think any research a person could bring to their doctor to support using it for this condition. I think I'm answering the right question. Actually, LDN for the eye ophthalmic conditions is like great, because there's a lot of toll-like receptors and interleukin receptors and expression on the cornea. And so, yeah, it would work great. There are some sterile eye drop formulations. You could contact Dr. Rashidi, and I mean, I can give some of those, but yeah, because you can use it for dry eye, you can use it for Sjogren's, rheumatoid arthritis, scleroderma, anything, uveitis. It just depends if you anterior nodular scleritis and posterior scleritis. I'm looking at some of my notes from a lecture. They have used it. So yeah, I think it might be good, actually in drop form, not necessarily oral. So
yeah, and the drop form, the only thing is like your state of California has a lot of regulation on sterile compounding, and the whole United States has. I mean, it is like so there's not enough studies, so we can do it. The only thing is just gonna have really short expiration date. So we've talked about this, and we're actually working with some of the big companies like PCCA. They're trying to do some studies on it. So hopefully we can get that for a lot of patients that they need as far as the eye drops. Those studies cost a lot of money. So, and there's not a lot of people who probably benefit from it, but there's still a need. So we're looking into it. Hopefully it will be sooner than later.
Right. And theoretically, it could work,
Yeah.
it could. So. Can we use LDN topical on neonates or infants for eczema? Yes, It works really well on eczema, actually. So, yeah.
Dr. Mathewson, would you like to go next?
Let's see. Can healthy people take it for anti-aging? Yeah, I mean, healthy people can take lots of things for anti-aging. This would be a candidate for it. I don't see any reason why not to. I generally, when I'm prescribing this, I like to be able to at least document a reason in my chart, not just sort of like, I'm interested in trying that. So, you know, even if I can get something like seasonal allergies or something inflammatory, is like, okay, let's track and see if we see improvement to those systems, I'm going to be more likely to dispense. But yeah, I mean, certainly I don't see any reason why it wouldn't have benefit in folks that don't already have a cancer process or an autoimmune process or a highly inflammatory process going. Yeah.
Thank you.
Remember, being over 40 is a high inflammation process.
Yes.
And somebody asked, I have a kitty that suffers a lot with allergies. Can LDN help her? I mean, we have seen good results with allergies with human. I haven't seen much with pets. We haven't done much, but I would think so. It should. I mean, and then who would do it? Of course, you have to talk to your veterinarian, see if they're comfortable with it. If not, as I mentioned, there are a couple of studies we can say it is safe on pets, so it's safe for pets, so it shouldn't be any problem. So we can always try a really low dose and see how they do. I would imagine it would work for them as well.
We have a long COVID question. Would you like to answer that, Dr. Sato-Re?
Okay, I'll go for it. I'll try. I've been living with long COVID for 2 years, diagnosed 23 symptoms overall that come and go in number and intensity daily, none of which I had prior to COVID. Most impactful is multi-inflammation, particularly joints of limbs and fatigue. I'm in the UK. Doctor wrote prescribe only 50 to 100 milligrams. Approached private clinic through the LDN website, but would only prescribe for other diagnosis, not long haul COVID. Immunologist was approached via GP regarding possibility of mast cell activation syndrome diagnosis as very similar, but refutes as no anaphylaxis. Could buy online, but worried about quality. Any suggestions? Okay, so it sounds like you have a lot going on, and long haul COVID, again, it's one of the first line therapies that LDN is coming up with. It may not be the only. There's a lot of cytokines that people are actually seeing with long haul COVID. There's a test by Dr. Bruce Patterson that is a cytokine test that looks at like 13 or 14 different cytokines. He was out of Stanford. He left Stanford, and it's a great test for people to use and see what cytokines are elevated, and then you may be able to track by using LDN to see if those cytokines would go down. They're using other therapies as well. So there's, besides LDN, there was on that list ivermectin, just lots of different things to try.
I'm going to answer the MS question. Do any of you have specific experience giving LDN to people with primary progressing MS for fatigue? I've used LDN with MS as a general approach, but not necessarily just for fatigue. So I want the anti-inflammatory benefit. I want the autoimmune benefit as well. I think it's worth trialing to see if it can give a little bit of support to the fatigue that comes along with multiple sclerosis. But it's also worth bringing on board just because that's an autoimmune disorder that could really benefit. And I've seen significant benefits with using LDN with MS. So yeah, a couple reasons to consider that. Definitely. I think that's a good idea.
Yeah, there are a lot of studies on, I think, LDN with MS. So that you can show your doctor probably would help. And then somebody asked about the twice dosing. I think we talked about it a little bit. There are some benefits for like pain management. And then also we talked about like depression and anxiety, that 1 milligram twice a day that was done by Harvard study. So they looked at the 1 milligram twice a day. So there are some application for twice a day, and the reason for it just because LDN, I mean, the naltrexone has a very short half-life, so it doesn't last whole day to increase your endorphin or whatever it's supposed to do. So especially with pain, you want those receptors to be filled up, so you probably need it twice a day. And we've seen better result with pain than twice a day dosing.
I'm going to take the LDN for HPV human papillomavirus. I think that's a great question. When I don't think of LDN as having direct antiviral action, but I do think of it as having really nice, again, generalized immune support. And when we're having a flare of anything viral, whether it's HPV or Epstein-Barr, we know that that's taking a lot of the immune system's resources, kind of distracting it. So considering trialing LDN to help support with HPV, I think is reasonable. Now, if that HPV is progressed and we're getting some dysplastic cells, 100% bring LDN on board, absolutely. So I'm talking if that's a dysplastic cells on like a PAP, and as we know, HPV can move into becoming cancerous in multiple circumstances. So definitely worth treating HPV up front. And I think LDN could be a nice addition too. I haven't been using LDN with my just HPV patients. So that's an interesting question. I'm going to think more about that, but I don't see why not to. And I think it could potentially provide some benefit.
We have a chapter on LDN and viruses in the third book. You'd find that really interesting.
I definitely, 100%, yes, I will read that. Cool. Is that in the first book or the second one?
The third one, that's yet to come out.
Coming.
Excellent. Excellent. I'm excited for that.
Okay.
The last question, Masoud.
Okay, and the last one, this is interesting as far as anybody known if LDN has been used for gum problems. And most of the gum problems, and then we use it a lot for dental use for any inflammation. So I've seen some use, actually, they use it orally, like systemically, not topically mostly. It does help with the inflammation, and that helps. I've seen some good results, and some dentists actually they do use a lot of LDN for a lot of gum disease or any inflammation. And if it's due to inflammation, of course, if it's not infection, but inflammation-wise, it would help really well.
Okay, well, thank you very much, everybody.